Let's continue here with taking a look at incidence versus prevalence. And the two terms are often confused. The way to remember it maybe is to think of incidence as new cases versus prevalence is everything, all old and new cases. So incidence, let me give you an example. I'm looking at the coronavirus data as of yesterday, which was May 12, 2020. So the new cases yesterday in the United States alone were 22,802. So the incidence of coronavirus yesterday, May 12, 2020, was 22,802. Or you can express it as per week or per month, a specified time period that where you then count the cases, and it's usually expressed as a percent of the total population. Now, if we're looking at the prevalence of coronavirus in the United States, we're looking at a total case number of 1.408 million, so 1,408,636 as of yesterday, May 12, 2020, and that gives us a prevalence in the United States currently at 4,256 per million of the population, so that would be 0.43% of the population. That's the prevalence currently of coronavirus in the United States. So hopefully that was a little bit helpful, that you figure out what the difference is between incidence and prevalence. Now here are some terms I'm pretty sure you are familiar with. Sporadic disease is disease that only occurs occasionally. For example, rabies or meningitis would be good examples for sporadic disease. It just occurs occasionally. Endemic disease means that a certain percentage of the population has the disease. It's present at a certain rate constantly in a population. Good example for this might be cold viruses that are around. It's of course has a higher incidence during the winter months, but it's always present in the population. Epidemic means that you have, from this baseline, you have a sudden spike in cases. You have a sudden increase in cases. And so here the definition, the disease is acquired by many people in a given area in a short time. So let's say flu epidemic. Every year we have a sudden spike in cases in the winter months, and that would be considered epidemic as long as it's confined to a certain area. So let's say if you only have cases in the United States, then it will be an epidemic within the United States. Or if it's measles outbreak in California, then you have an epidemic of measles in California. Now, if the epidemic is worldwide, then, as you know, the term we use is pandemic. That means we have a worldwide epidemic, and that's what we're seeing currently with the coronavirus. It's a worldwide epidemic. Tortora gives us the example of AIDS cases to take a look at some of the epidemiological terms. So you can see we're starting here in the early 80s, 1983, the first cases started to appear, and then there was a sudden spike in cases. When here, of course, the expansion of the way to report the cases, there was some improvement in the technology that then caused this spike in cases. But here you can see that first here's an epidemic. Would be considered epidemic in the United States, and then now we have a constant level, so this would be now considered endemic, the cases of AIDS in the United States. So AIDS is now endemic in the United States. Now, if we were to see a sudden spike in cases here again, so all of a sudden we're seeing a sharp increase, then there will be an epidemic. If it's worldwide, again, it will be a pandemic. More terms here. So we call something acute disease when the symptoms develop rapidly, but the disease lasts only a short time. So acute disease, let's see, swine flu came on really fast. You had severe symptoms for a few days, and then it subsided, and it was lasting only a short time. Chronic disease develops slowly and is chronic. That means it stays with you for a long time. Good examples would be hepatitis. They stay usually chronic. Subacute disease is intermediate between acute and chronic. So it's sub means below acute disease. So there you don't have this just for a short time, but it's not chronic, but it's not really a short thing either. Latent disease means that the pathogen is inactive for a time, but then it activates and produces symptoms. Good example for that are the human herpes viruses. For example, the cold sores, so the virus that causes the cold sores, it stays latent. It never goes away. It stays latent, and then when it has an opportunity, then it will cause the cold sores again. Usually we call it cold sores because it's associated with a cold. Oftentimes your immune system is busy fighting off a cold virus, and then the cold sore virus gets reactivated because it sees an opportunity. Your immune system was distracted and busy fighting something else. Another term that you've been hearing lately a lot is called herd immunity. That means that enough of a population is immune to a certain pathogen, and that means that the spread of an infection is limited. If you have enough people that are immune to something, then the person-to-person transmission will be very limited. And that's what actually the anti-vaxxers are banking on, that enough people are immune to, let's say, measles, and therefore why should I get vaccinated against measles? Because it can't spread, there's enough herd immunity, so I should be protected without being vaccinated. And the problem is that too many people were relying on that, and you know that there was a measles outbreak, and the herd immunity, basically there were holes in the herd immunity, and so therefore the virus was able to spread again. It's also something that people talk about with the coronavirus here currently, that if enough people in the population are immune, either they went through the disease or maybe potentially there will be a vaccine, then the herd immunity will protect those people that would still be susceptible, that weren't vaccinated or weren't infected yet, and so they will be protected just because there's too many people within the population that are immune to this disease. Moving on here with more terms, and I have to warn you, epidemiology, there's a lot of math, a lot of statistics involved, a lot of terms, and it's somewhat a little bit of a dry area of microbiology. Here, moving on to the extent of host involvement and the terms that are describing that. So let's start with local infection. That means that the pathogen is limited to a small area of the body. So local infection, let's say you cut yourself and there's a local infection going on and you have the inflammatory responses locally, but it's not affecting the whole body. If your entire body is involved, then we have a systemic or generalized infection. Most people use the term systemic for sure. Focal infection is a systemic infection that began as a local infection. And more terms, sepsis, that means toxic inflammatory condition arising from the spread of microbes, especially bacteria or their toxins, from a focus of infection. So let's say you had bacteria that came in, it was first locally, and now sepsis means that the microbes are spreading, and typically they're toxins, they're causing severe reaction. Bacteremia means that you have bacteria in the blood. Emia refers to blood, bacteria, so that's bacteria in the blood, bacteremia. Septicemia, also referred to as blood poisoning. That means you have the growth of bacteria in the blood. And yet more terms. Toxemia means that you have toxins in the blood. Again, emia, when you see that term, it's blood. Viremia means that you have viruses in the blood. And a primary infection would be an acute infection that causes the initial illness. Secondary infection is an opportunistic infection after a primary predisposing infection. Let me go back to the example with the cold sores. So let's say you had a bad cold. That was your primary infection. And you were blowing your nose a lot, and the skin got kind of thin from all the blowing of your nose. And then all of a sudden the cold sore virus is seeing an opportunity to break out again, and that would be a secondary infection. Or another example would be that secondary to a cold, you're developing a cough that's caused by bacteria. Subclinical disease, that means you have no noticeable signs or symptoms. It's something that doesn't require you to go see your doctor, make an appointment, or go to the hospital, for example. So now moving on here to predisposing factors. They make the body more susceptible to disease. Certain things you can't change, like your gender. If you've inherited something like the sickle cell gene, there's nothing you can do about that. Climate and weather, I guess you could move, but it might be inconvenient. Plus, the climate is changing around the world. Fatigue, you can definitely get some rest, so you could do something about that. Age, unfortunately, we can't do anything about that, even though that's a risk factor for many different things. I wish we could change that, but unfortunately, that's not possible. Lifestyle, you can certainly do something about that. Usually, healthy diet and some exercise. Very good things for you to do for your health. So lifestyle, nutrition, there's certainly something you can do about. Chemotherapy, let's say you're taking a round of antibiotics, then it makes you more susceptible to an opportunistic pathogen that now sees an opportunity to take the growth niches that were previously occupied by bacteria. And of course, other substances, chemotherapy, might make you more susceptible to disease. Here are some terms that are associated with development of disease. The incubation period, you may have heard about the incubation period for COVID-19, and people are still not quite clear. It seems to be quite different for different people, so there's a pretty big range with COVID-19. But the incubation period is defined as the interval between the initial infection and the first signs and symptoms. Now, I've seen cases where there was reported that the infection with COVID-19 occurred only a day or two prior to the first signs and symptoms, and for other people it takes 2 weeks for them to develop the first signs and symptoms. Generally, they put in COVID-19 as an average incubation period of 5 to 7 days, something like that. Another term that you should know is prodromal period. That means it's a short period after incubation where you have early and mild symptoms. And a lot of times you're infectious during that time. The period of the illness is where the disease is most severe. The period of the decline, the signs and symptoms subside, you get better. And the period of convalescence, where the body returns to its pre-disease state. So here is the chart that goes along with this information. So here, time 0, that will be when you get infected. Then you have an incubation period where you have no signs or symptoms. You feel just fine. And that is usually disease-specific, pathogen-specific. As I said, the average incubation time for COVID-19 seems to be about a week, 5 to 7 days. Then you have this prodromal period where you have mild signs or symptoms. It's just starting. You develop a cold, you started feeling coming on, you have maybe your nose is itchy and you start sneezing. So that would be the prodromal period. Then you have the period of illness and you're feeling worse and worse and worse and worse. So that will be the period of illness. And then you start getting better. That will be the period of decline. And then here you're in convalescence, where your body recovers from to the pre-disease state. Let's move on to reservoirs of infection. We call something a reservoir if it's a continual source of infection. So if you have human reservoirs, that means humans are a continual source of infection. And if you call somebody a carrier when they have inapparent infection or latent disease, but they still have the pathogen. Animal reservoirs, they are called zoonoses. That means that these diseases are transmitted from animals to humans, and apparently that's what we have with the coronavirus. Coronaviruses are actually known to be zoonotic. That means they get transmitted from animals to humans. So apparently we have here a transmission from bat to humans. With the MERS, the Middle Eastern Respiratory Syndrome, that was a few years back. It's very similar. It's also coronavirus. That one was transmitted from camels to humans. So there are different zoonoses, and you should know this term where you say something is zoonotic if it gets transmitted from animal to human. Sometimes we also have non-living reservoirs that would include soil and water sources. In that case, it would mean that you could possibly get sick from contaminated drinking water.